World Glaucoma Week is a joint global initiative of the World Glaucoma Association and the World Glaucoma Patients Association to raise awareness of this condition, what it does to your sight, and how it might affect you. Dr. Shailendra Sugrim is a consultant ophthalmologist in Guyana, and he takes a look at the prevalence of glaucoma in his country and the wider Caribbean.
In Guyana, the trend follows those of the other Caribbean countries. I mean, here our people, with regards to health of the eyes, they have a kind of a lack of a knowledge about the certain diseases that affect the eye. And especially so for glaucoma, it's worse because you only know you have glaucoma when it becomes advanced, right? So that's the catch with glaucoma. We need to screen the patients early to catch the disease. And the only way you can screen is the best way that we have figured out for screening patients is those at risk. And those patients at high risk for glaucoma include those with family history. And many studies have shown that those of African ethnicity are at increased risk. Also, patients with diabetes and other minor vascular problems are at risk for glaucoma. The trend here follows those that have been shown in the Barbados and St. Lucia eye studies that it's common, those of the Afro-Guyanese descent. But we do find glaucoma also in our subset of Indo-Guyanese, and what I've found here in Guyana that the trend for the Indo-Guyanese has been more towards normal tension glaucoma, but I'm not saying that the regular open angle glaucoma does not apply. It is there across all borders, but I just find that it's a little bit more trend that the Indo-Guyanese have the normal tension glaucoma, which is a little bit more difficult to diagnose also because the pressures are normal, and your regular screening doctor would probably set the pressure and say it's normal, you don't have glaucoma, but you need to do intensive tests and examination for the Indo-Guyanese patient. Because the disease presents in the advanced stage, when you look at the African Guyanese patients, you will notice the signs readily, and you immediately send them for treatment. It's also difficult to treat them when they come in when they're advanced because they have already lost a lot of vision, and the options for treating them are not a lot. So we usually go by giving them the medical treatment, and then if it doesn't work, we try the surgical because we don't have lasers available. Mostly here in the Caribbean, we hardly have laser treatment available for glaucoma. It's highly prevalent here in Guyana, and it's a big problem, and we don't have a formal study as yet to show the high prevalence. But based on my work here in the clinic, I know it's a big problem, and I know that it's following the trend of the other studies that we have done in the Caribbean.
Is there a greater role that needs to be played in terms of educating people?
Oh, definitely. Education is key in treating glaucoma. We need to educate the general public about glaucoma. They need to know that it is a disease that starts early and you don't know you have it. Majority of the patients with glaucoma did not know they have it. And most of those that come in know because they probably have a relative or somebody told them about it, and then they're scared, so they want to come and check for glaucoma. We need to sensitize the public, tell them about glaucoma, educate them about the signs. Usually there is no sign in the early stage of the disease, but in the late stage we can alert them about the signs that they can have, which includes like spots, and they may have decreased peripheral vision, they may have problems in the night vision. But once we catch it early, we can treat it and prevent blindness in that way, because it is the leading cause of irreversible blindness in the whole world.